Are you aware that there are some harmful actions we take when handling our children? Are you aware that such actions can cause unnecessary expenses or traumatic consequences? One such consequence is called pulled elbow. What is pulled elbow? A pulled elbow, also known as nursemaid's elbow, is a common injury that occurs suddenly and unexpectedly when the radius bone in the forearm slips out of place at the elbow joint. This typically happens when a child's arm is pulled or jerked, causing the bone to partially dislocate. Pulled elbows are more common in young children because their bones and joints are still developing and are more prone to injury. Pulled elbow can occur when we pull or jerk a child's arm, like when pulling a child from one point to another by the arm, lifting a child incorrectly, swinging a child to give them a happy moment, pulling a child away from danger, playing tug of war. The symptoms include pain or tenderness in the elbow or forearm, swelling or redness, limited mobility or stiffness. Pulled elbow can lead to serious complications, such as dislocation, elbow joint instability, fracture, cost implications such as significant medical expenses, long-term consequences which could result in nerve damage, paralysis, and even loss of limb. So, how can we prevent pulled elbow? Lift children correctly by supporting their body and legs, rather than just the arms. Avoid jerking or pulling a child's arm. Hold hands correctly. Avoid swinging children by their arms or hands. Teach children to fall safely by rolling with the floor and not putting out their arms to break a fall. Seek medical attention if you suspect a child has pulled elbow. Treatment for a pulled elbow typically involves reducing the dislocation by gentle massage, immobilizing the arm with a splint or cast, applying ice to reduce pain and swelling, rest and avoiding activities that aggravate the injury. Remember, pulled elbow is a preventable injury. By being aware of the risks and taking simple precautions, we can keep our children safe.